Hello students, welcome back to my digital classroom. In my last class we have discussed about the drugs and medicine, then what is self-medication, what are the dangers of self-medication, what are the proper ways of drugs and drug abuse. Now in today's class we will discuss about that different categories of drugs and how they are classified into different categories according to their abuse potential. Now, the drugs that are likely to be abused may be classified into 4 categories according to their abuse potential. These are narcotics, depressants, stimulants, and hallucinogens. Apart from these, alcohol and tobacco are 2 other substances most commonly abused throughout the world. Narcotics, depressants, which are mild sedatives, barbiturates, and tranquilizers. And stimulants are essential to practice modern science. Okay, but the category belongs to hallucinogens are used only in medical research purpose. These drugs, when administered without medical supervision, that time they are said to be abused. Now, all substances with their abuse potential can produce changes in human behavior, particularly when large amounts are improperly used. When anybody use these drugs in large quantity and improperly. As a result, whatever, the abuser may feel intoxicated, relaxed, withdrawn, and solitary. Or they may be extra sociable, more talkative, and quick to agree or believe. These changes, which occurs due to the use of all these drugs, may either be harmless or may pose serious threat to both the abuser of the drugs and society. Now we'll discuss about each category in details. First of all, what are narcotics? Narcotics is a kind of substance which is used to treat moderate to severe pain, like morphines and codeine. But these are not made from opium. They bind to opioid receptors in the central nervous system. This kind of drugs, it reduces the receptor in the central nervous system. Okay, the term narcotics originally referred medically to any psychoactive compound with numbing or paralyzing properties. Narcotics produces sleep or drowsiness and numbing effect on consciousness. It also reduces body activity and produces relaxation. out of various kinds of narcotics. Some narcotics are used by physicians and dentists to relieve or prevent pain. Codeine is an important component of commonly available cough syrup. Then Novocaine. It is used by dentists for local anesthesia before filling or extracting teeth. And another category of narcotics, that is morphine, is also used to smother unbearable and severe pain. Narcotics can be fatal if not used under medical supervision. And some of these narcotics are known to cause addiction. Okay. Next category of this drug is depressants. Now, technically, a depressant is any substance that depresses the central nervous system of the body. In fact, some depressants are designed specially to treat conditions like anxiety or insomnia. However, other depressants are used recreationally. Depressants are drugs that inhibit the function of the central nervous system and are among most widely used drugs in the world. These drugs operate by affecting neurons in the central nervous system, which leads to symptoms such as drowsiness, relaxation, decreased inhibition, anesthesia, sleep, coma, and even death. Now, as I told you, this drug affects the central nervous system. It reduces the body activity and produces muscular relaxation. Depressants are prescribed to the patient because they give a soothing feeling and reduce anxiety and tension. But if depressants are taken in large doses, it can lead to artificial sleep, then to coma, and finally to death. Bromides are also depressants and should not be used without consulting a qualified physician because they are intoxicating and poisonous. Another category of depressant commonly used is barbiturates. It is generally present in many sedative or sleeping pills. Therefore, indiscriminate use of these drugs should be avoided. Otherwise, it may be extremely dangerous. Some of these drugs and alcohol can give rise to addiction. Alcohol is also a kind of depressant. Next category is stimulants. Now, stimulant is an overarching term that covers many drugs, including those that increases the activity of the central nervous system and the body. Stimulants increases the activity of the central nervous system, which produce excitement and decreases the desire for sleep. They also cause loss of appetite. The apparent effect is the increased activity for a short time by using reserve stored energy. Okay. Stimulants, what it does, the apparent effect is that the increased activity for a short time by using the reserve stored energy. Then there is a sudden decline of activity because this reserved energy in our body, this reserve energy are stored for basic metabolic activities. When these energies are consumed, then there is a sudden decline of activity, and as a result, what happens? The victim needs more and more stimulants. Some stimulants, such as amphetamines, are used medically to combat depression in psychiatric cases. Most of the stimulants are used in case of psychiatric cases. The patient who are too much depressed, in their case, some kind of stimulant medicine is prescribed by doctor. But stimulant can also cause addiction. Last category of these ABC drugs is hallucinogen. The name of hallucinogen itself explains its main effects. Hallucinogen results in illusion and hallucination. Now, what is illusion in that case? Illusion is the distorted image of the object seen, and as a result of these hallucinogen drugs, the abuser cannot distinguish between a fact and a fantasy. During hallucination, a person sees images that do not exist. These drugs affects one mental and visual perception, and such illusion may lead to antisocial behaviors such as stealing, violence, and ultimately it may result in fatal accidents. Hallucinogens are a diverse group of drugs that alter perception, thoughts, and feelings. They cause hallucination or sensation, an image that seem real but they are not. Now, hallucinogens are split into two categories: classic hallucinogen and dissociative drugs. A hallucinogen is a psychoactive agent that often or ordinarily causes hallucinations, that is, perceptual anomalies and other substantial subjective changes in thought, emotion, and consciousness that are not typically experienced to such a degree with other drug classifications. The use of drugs, all these kinds of drugs, does not help an individual to solve his problems. On the contrary, it can cause irreparable damages to an individual's personality and can be life-threatening too. Therefore, it is advisable to abstain from the misuse of any such drugs. The youth is at a greater risk of getting addicted to these drugs. Therefore, generating adequate awareness regarding the issue, that is drug abuse, is essential, because nowadays it is a major problem throughout the country. The cases of drug abuse are increasing day by day. Okay. Now we'll discuss about the other substances with their abuse potential other than whatever we have discussed here. Now, among the other substances that are abused generally are tobacco and alcohol. Now, tobacco is a dry leaf. It is obtained from a nicotine-rich leaf of a plant which grows in many parts of the world. The leaves are dried and cured to produce tobacco, which is used in the preparation of cigarette, bidi, and other similar products. This tobacco leaf, it is also used for chewing purpose, and some people use it as snuff in the powder form. The smoke of cigarettes and other products of tobacco give out carbon dioxide, carbon monoxide, and numerous other poisonous substances, along with numerous tar-like chemicals which are extremely harmful, and most importantly, they are cancer causing substances. It is proved that nicotine, the type of chemical, harmful chemical present on tobacco, causes abnormal cell division, and ultimately it leads to cancer. Nicotine and other chemicals enter the body through the nose, throat, and lungs. The effects of nicotine in human body are dizziness, headache, and may affect blood circulation, respiratory problem, and digestive problem. In case of heavy smoking, it increases the rate of heartbeat and causes rapid palpitation. Smoking is also associated with cancer of lips and larynx, chronic bronchitis. Apart from cancer, it may cause chronic bronchitis. It may lead to lung cancer and peptic ulcer. Therefore, young people should be sensitized to the life-threatening harmful effects of smoking and chewing of tobacco in any form, because tobacco also can cause addiction. Now next most commonly abused substance is alcohol. Now what is alcohol? Alcohol is a fermented organic liquid obtained by the natural fermentation of malts and sugar. It is the intoxicating constituents of wine, beer, spirits and other alcoholic drinks. Now, the kind of alcohol used for drinking purpose is ethanol or ethyl alcohol. Now, people also sometimes use alcohol such as methyl alcohol and isopropyl alcohol. But methyl alcohol is toxic as it deadly poisonous and it may cause blindness and even death. So, it is unfit for human consumption. Isopropyl alcohol is widely used as a solvent and cleaning agent. Okay, isopropyl alcohol is widely used as a solvent and cleaning agent. This alcohol, when taken in small quantities, it causes intoxication. As a result, the heart beats more slowly and the muscles of the blood vessels relax, causing the skin to flush. But if the consumption is high and continued for longer period of time, then speech becomes indistinct and there is a loss of balance, and finally reaches the stage where one cannot see clearly and falls asleep. In case of excessive drinking, it causes unconsciousness and may even cause death. The effect of using alcohol varies with the amount of alcohol present in the blood. Now, alcoholism generally it leads to addiction because of its effects as a depressant. The person who drinks alcohol in an uncontrolled manner is called an alcoholic. Okay, the person who drinks in an uncontrolled manner, they are termed as alcoholic, and he becomes a slave to alcohol. Generally, addiction to alcohol starts from drinking occasionally to moderate drinking and then to heavy drinking. The individual thus becomes completely dependent on alcohol. So that's all for this chapter. Again, in my next class, I'll discuss about the international health from unit 4. That international health and also the importance of international health. So till then, take care of yourself, study properly. We'll meet soon with new chapter. Bye.